I'm looking ahead, and I've been listening to this conversation, and I think there were some questions in the chat around some of the supports to enable and engage patient family caregivers in work.
If we're talking about policy in terms of, integrated care and caregiver, patient, and community, engagement, definitely more conversations or more, I don't want to say requirements, but more encouragement of higher levels of institutions and folks really incorporating, incorporating in community, patient, and caregiver into conversations around policies at their institution. So I think folks, I was skimming through some of the chats, and folks were saying, how can we be better at involving folks at the table if we have this involvement on the side of our table, right? And we don't actually have the opportunity to really actively, reach out to and engage with folks. So I say, there should be more policies around dedicating X amount of time to making sure that folks have the time to actually do this in a way that's effective, that's consistent, and is sustainable. So I think Robin mentioned, earlier, oftentimes that happens where you start the journey, then things happen, people fall off, and so on and so forth. We need to push for policies that make this type of engagement sustainable, and that, again, folks feel that they're seeing, not just feel that their perspectives and feedback are taken up, but they actually see that taken and used to impact care and done in a way that is ongoing and not just a one-off. Because we get those funding pots, it's a one-off opportunity, and then we, unfortunately, depending on how things go, have to move on to the next round. So how do we make sure that folks, their feedback is taken up and actually done in a way that's consistent? And again, when we talk about different organizations and different folks, we need to make sure that everybody gets a chance to speak their mind and make sure that that is a part of the conversation.
Great, thanks a lot, Nikia. So,
Thanks.
Ellen, and maybe you might touch on the sustainability of things too, just to make it more complicated.
Yeah. Well, I think I wanted to just pull back in something that we talked about earlier in our conference here, and just that, people need to be involved from the very beginning. I don't know how many times I've been involved with things where it's like, okay, we've got our goals set, we've got our committee set up. Now let's recruit some caregivers and people, individuals onto that. And it's like, that's way too late. You're in the wrong spot. And I think that is part of the sustainability part of it too, because if people are involved from the beginning, you will head in a direction that is able to be built that way. The second, and I think very much related point to that, is I think one of the things that I see all the time is that we're very much a referral-based system, and that's around power and gatekeeping and those kinds of things. So if we can move away from that and make it a partnership, so we're talking about what's needed, everybody's at the table. In a lot of ways, I don't think it's, I think it's changing what already happens within the system, but doing it in a different way. So it's not more money, it doesn't need to be sustained, but the power needs to move, and power, that doesn't often cost money to be able to move that power. So I think if we embed it right from the beginning, then we'll have the sustainability.
Great, thanks. Maybe Sandra, just one or two sentences, and then on to Robin, and then we'll let Jodine come back. And Carrie's coming back.
I don't have a problem saying that I think it needs to be regulated, and that patient engagement needs to be a something that is required in research and in healthcare. I think in research, which I do a lot of work with, is it's got to be on the grant, but it's got to be the whole thing, and in healthcare as well. And until we start making it a priority, I'm sorry, it feels like lip service to patient partners and stuff. And I'm going to use a quote from Julie Drury, who was past chair of the Ministers' PFAC in Ontario. And this goes to what you're saying, Helen, is that we as patient, family, and caregivers and communities, we want to be there when the mix is being bought to build the cake and it's being put together, not when it's coming out of the oven and then we're just the frosting on top of it. If we could work towards that, that would be great. And I do think, as Robin said, I do think our governments need to take a lead. And if it has to go on funding, it has to go on funding. I don't know any other kind of organization or job that I've had where my performance wasn't based on the amount of pay that I got. And even to add to that, who is the ones that are auditing and giving performance appraisals on our healthcare providers? You know, we can do proms and we can do prems and whatever like that, but what's happening with that and how we're going to make change? And those are the kind of things I can say as a patient that you might not be able to say. But
Thanks.
anyway, those
No,
are the
no, it's
ways.
absolutely wonderful to hear that, and to hear the strength. Robin, go to you, and then I think Carrie has her final bullet round.
Yeah, thanks. Oh, yeah, no, agree with everything that's been said, and I do agree with Sandra that money does talk in many ways, and certainly what we've seen in the UK is the big health and social care research funders now have an expectation that actually people who would benefit from research will be involved in the design, the delivery, the dissemination. And that has made a huge step change in terms of people's engagement with people's lived experience of health and social care, because those who want to do it feel as a mandate to do it. Those who are perhaps a bit more reluctant, a bit shy about it, realize they have to do it. And if they don't do it, they won't get funding. And we're far from perfect. But you can see over the last 5 years that the engagement of people with lived experience throughout the kind of research process, and indeed being involved as co-researchers, has stepped up hugely. The other thing I think we need to think about is giving people the skills and the confidence to meaningfully involve people in their practice and their research. And I think there's a big role for professional bodies, regulators, to make sure that throughout people's professional career, right from the time they're qualifying, through post-qualifying, in terms of their performance appraisal and development, that we have the skills and the knowledge of how to engage people and communities in their work is absolutely seen as a key health and social care professional task. It shouldn't be a nice to have. It should be something that we should see as a requirement of strong professional practice. And I think if we embed it throughout careers, then as we get the young professionals qualifying and going on, they'll just see it as part of what they do. And that's really where we're going to change the culture of our systems to make them much more community orientated.
Mm-hmm. Thank you, Robin. And what I'm hearing about is we need accountability in our system. How we hold providers accountable, how we hold ourselves accountable, and really build it into the fabric of how we do healthcare. It should be an automatic that we engage with communities, patients, and families, not a nice to have, but a must have. And I think probably aside from this audience, you know, many might think it's still a nice to have and not an absolute must. And so there's some work to do to kind of embed that in our system. And I wondered now if we do go to what Walter was saying, a bit of a bullet round. So any final takeaway nuggets, words of wisdom that you want people to walk away with, maybe something you generated through the discussion or something you want to go back to that you mentioned earlier. And I'm looking at the top of my screen, Helen, not to put you on the spot. Do you want to go first and then over to Nakia?
Sure. Thank you for that. Well, I think we talked about it kind of throughout this discussion, but I think what we're hearing is that support and changes are needed at that individual level, that interaction and that includes the caregivers within that, but also the community level, those support systems, and at that system level. And it's changes all the way through there that have to be worked at all at the same time, but it's very much possible.
Thank you, Helen. Nakia.
So I always, it's these kind of bullet speed rounds reminds me of a quote from an event I went to by ex-MP Selena Cesar Chavanes, and she said, "Equality is ubiquitous, equity is not." So if we are going to really have conversations about making, you know, our healthcare system a more equitable, inclusive, and diverse space, we really need to have conversations about how are we defining the very things we're trying to change.
Thank you, Nakia. I'm going to take that one away. Robin.
Yeah, not quite as snappy as Nakia's, but I think there's something I'm being really clear about the fact that there's different ways that people's lived experience can shape and get involved in health and social care systems. And whether you're going to get somebody or somebody's going to be involved in terms of improving a pathway, or perhaps designing a population level approach, or perhaps being a kind of constructive challenge to what's currently in place. We need to be clear these are different types of roles, and therefore we'll need different types of supports and skills in order to do them. So I think we need to go beyond simply saying it's important that people are involved to saying, well, how are they involved? How could we strengthen their involvement, and how we can support them to do that in the long term?
Thank you. So really digging into the how. Thank you, Robin. Sandra.
So I wanted to take this moment to thank IFIC Canada for the job that they're doing, and all the co-panels, people that are here, and everyone that's online, healthcare providers and patients and families, because I realize that you're all dedicated to making this happen. And although we brought up things that are not working and we're addressing areas, there's a lot of things that are working. And the people here that are on this call are dedicated, and they work really hard at trying to make the system better. And I want to acknowledge that these things that we're bringing up today are ways that we can work forward. But, you know, our healthcare, I mean, I get excellent healthcare, you know, and ways, there's things that we can always improve. But I want to acknowledge everyone is here, you know, our primary care providers and those that are working in healthcare. And just want to say thank you. Thank you for everything that you do.
What a beautiful way to cap off this discussion. Thank you so much, Sandra. And thank you to everyone for engaging in this discussion and creating the space where we can really learn together.